This is what we hope is happening in nursing homes. Plenty of helpful staff interacting with residents in activities to keep them happy and healthy. But according to the private nonprofit foundation called Families for Better Care, Alabama's 228 licensed nursing homes deserve a grade of D. Not quite failing, but not good.
One of the primary reasons that the state scores so lowly is that residents receive less than 38 minutes of professional nursing services per day. Those are those registered nurses who supervise the frontline caregivers.
Many of the people who care for nursing home residents are not registered nurses, so they're not considered professionals. They're licensed practical nurses, that's LPNs, or certified nursing assistants. Lee also says contributing to the bad grade, the percentage of facilities in Alabama that got written up for a deficiency by state and federal inspectors last year. The foundation contends it was 96%. But the medical director of the Alabama Department of Public Health, who oversees many of those inspectors, says that percentage is not out of the ordinary. According to the numbers from the foundation, the average in the U.S. is 90%.
This is called the State Operations Manual, and this is a 622-page book that follows the Code of Federal Regulations.
And there are 522 distinct rules in that book which guide the surveyors during an inspection. Some are minor, like not having enough petty cash available on the weekends. Others are serious, rules that safeguard the health and safety of residents. And the state did well in the Families for Better Care ranking on the number of severe deficiencies, earning a grade of A in that category. And Dr. Geary says there are other positives for the state as well.
Alabama actually stacks up very well in terms of the per capita spending for nursing homes.
According to the Public Policy Institute of New York State, Alabama ranks 14th in the country, spending an average of $185 per resident.
Anything that we put into our report, really most of it is coming from the nursing homes themselves. And it's all federal data, it's all public data.
Now, no one's arguing the facts in these government inspection reports, but it's the grading system that the Families for Better Care uses that many have a problem with. As a matter of fact, it's the group in general. Turns out Families for Better Care is actually funded by a Florida law firm that specializes in nursing home lawsuits.
Families for Better Care is nothing but a shell organization for a trial lawyer firm, and from what we've been able to tell, their only agenda is to line the pockets of these trial lawyers.
The foundation's 2011 income tax filing shows it was fully funded by the trial lawyers group of Wilkes and McHugh. Their website says the firm out of Florida has been recognized as pioneers in nursing home abuse and neglect litigation.
They do provide donations to us, but they're not the only group that does that. We've had a number of donations this year from families and other groups as well.
All this is the trial lawyers finding a unique way to drive their agenda and line their own pockets, and they're doing this to get paid, to get earned media instead of having to go out and buy commercials.
Matson points out Families for Better Care has no members, no way to join, and Brian Lee is the director and the foundation's only employee. He also says the foundation offers no suggestions on how to improve nursing home care. Do you feel like that taints at all, the information you're putting out?
The information is the information, and if there are problems with the state's nursing home care, really the finger shouldn't be pointing to us. It's pointing back to the nursing homes themselves and what they have to do to improve themselves.
And we looked at that information, specifically these deficiency reports from the Department of Health and Human Services. Now, these are the forms that are filled out if a nursing home breaks one or more of those 522 rules we talked about earlier. They are not easy to read, but some of what we found in here about several nursing homes in our area was shocking. We're going to take a look at that part of the story coming up Thursday night at 10. Lisa Crane, Alabama's 13 investigates.